Welcome, Minister. Now, Senator Keller, floor is yours.
Thank you very much. I thank the Cathaoirleach for allowing me to raise this important issue, and I welcome Minister Daly to the House. Dementia is an issue that affects every community across Ireland, and there are an estimated 55,000 people living with the condition, with this figure expected to more than double over the next 20 years. People with dementia need a wide range of community services that will support them from the moment of diagnosis and throughout their journey. We are all aware of the significant gaps that exist in these vital services and supports. Under the National Dementia Strategy, the HSE committed to reviewing health and personal social services for people with dementia to identify these gaps and prioritise areas for action. I am aware that this mapping project was undertaken by the HSE in partnership with the Alzheimer Society of Ireland and concluded in October 2017. That was 4 months ago. And by the way, in the 4 months that have passed, another 1,300 people have developed dementia. And still the findings of the HSE review have yet to be published. As co-convener of the All-Party Oireachtas Group on Dementia, along with Deputy Mary Butler, I am acutely aware of the lack of equity in the provision of dementia services. In our Budget 2018 proposals, we advised the Government to provide funding for 30 dementia advisors across the country, increasing this funding over the following 2 years to reach 90 dementia advisors, one for each primary care network over time. Dementia advisors signpost people to services and provide much-needed training, information and support to families and communities, and yet there are just 8 of these advisors in Ireland. Access is on the basis of a postcode lottery, and for people living in counties such as Mayo, Roscommon, Kildare, Wicklow, Meath and Wexford, where the demographic profile and prevalence rates for dementia confirm a strong dementia population, this vital support does not exist. The gap in post-diagnostic support was also highlighted recently by former Minister Justice Nóra Owen on the 8th of February at the All-Party Oireachtas Group Dementia here in Leinster House, and again in conversation on radio with Marion Finucane on Saturday last. She told us that it took 18 months from her husband Brian's diagnosis of dementia for a visit from a HSE occupational therapist. That's a very long waiting time. This is not good enough for the estimated 4,000 people who develop dementia each year. That's at least 11 people per day. These estimates are not my estimates. They come from the official HSE Understand Together information campaign. Other gaps that exist include the lack of intensive home care packages for the majority of people with dementia who want to remain living in their own homes as part of their community. The All-Party Group advised that an additional £6 million should be invested in intensive home care packages for people with dementia this year, moving towards £30 million by 2021. Such funding needs to be ring-fenced, and there must be equality of access, with these packages being made available to people with dementia under the age of 65. We also need to address the gaps that exist in services and supports for specific groups, particularly for those living with dementia and Down syndrome. People with Down syndrome are at a much higher rate of risk of developing dementia. An estimated 700 people with dementia and Down syndrome live at home with ageing parents. Professor Mary McCarran, who presented to our group in June, estimated that 88% of people with Down syndrome will develop dementia, compared to 7% of the general population. We are not prepared for this challenge and must begin to establish regional centres of excellence with trained and experienced staff to complete assessments and to offer advice and support to people with Down syndrome living with dementia and their family members. While I welcome the work being done by the HSE's National Dementia Office to implement the National Dementia Strategy, the Government must now give clear commitment that it will provide the resources that are required to plug the gaps that exist in dementia community-based support. Therefore, I call on the Minister to ensure that the findings of the HSE mapping project, completed 4 months ago in October, are published as soon as possible and set out clearly the specific actions that will be taken to address and close the gaps in each community to have a better life for people with dementia and their carers all over Ireland. Thank you, Minister.
Thank you very much, Senator. Minister.